On today's edition of Know Your Health, we want to review 5 reasons why you see a milk discharge from your breast even though you are not pregnant or breastfeeding. We have been confronted with this kind of question in our community pharmacy and in the hospital by women of childbearing ages on why they see a milk discharge from their breast even though they are not pregnant or breastfeeding. You know, as a woman, upon seeing a milk discharge from your breast, especially when you are not breastfeeding or pregnant, it could be so alarming. So on today's edition of Know Your Health, we want to enlighten and also educate you that not all milk discharge from your breast is abnormal. There are some occasions where milk discharge is normal, such as in pregnancy. At the earlier stage of pregnancy, there could be a clear discharge from the nipple of a woman. Then in the later stage of the pregnancy, the discharge may take on a watery, milky appearance. The second occasion is stopping breastfeeding. Even after stopping breastfeeding, a breastfeeding mother may still experience a milky-like discharge from her nipple. Then this discharge may persist for a while until it finally comes to a halt. Then the third occasion is stimulation. When the breasts are being stimulated or squeezed, there could be a nipple discharge of milk. Then another occasion is when a woman is exposed to a vigorous exercise such as jogging. There could still be a discharge of milk from the nipple during this exercise. Going into today's edition proper, I want to review 5 causes of abnormal milk discharge from the nipple of a woman. Number 1 is fibrocystic changes. This refers to the presence or development of fibrous tissues and cysts in your breast. These fibrocystic changes may as well cause lumps or thickening in your breast, but this does not depict cancer. In addition to pain and itching, these fibrocystic changes can as well cause a yellowish or greenish milk discharge from your breast. Then the second cause is galactoria. Galactoria simply describes a situation whereby a woman experiences a milk discharge from her breast even though she is not breastfeeding. But this galactoria has up to 4 causes. One is the pituitary gland tumor. You know, pituitary gland is a hormone that controls other hormones. That is why it is called a master gland. It has 6 hormones at the anterior lobe and the 2 hormones at the posterior lobe that it controls. One of these hormones is prolactin. This prolactin is a hormone that is responsible for milk secretion from nipple of a woman. So when there is a tumor of the pituitary gland, there is an overproduction of this hormone. So when there is overproduction of this hormone, there could be a milk secretion from the breast of a woman even though she's not pregnant or breastfeeding. Then second cause of galactoria is certain medication. There are some certain medication that can as well cause this galactoria, such as psychotropic drugs, such as antidepressants. It can as well cause this hypothyroidism, some certain herbs, anise and fennel. Third is infection. Nipple discharge that contains pus may indicate infection in your breast, known as mastitis. Mastitis normally occurs in breastfeeding mothers, but it can as well occur in non-breastfeeding mothers. If you notice infection or abscess in your breast, you may notice a reddish coloration or the breast feels warm to the touch. Then the fourth cause is the mammary duct ectasia. This is the second most common cause of abnormal milk discharge from a nipple of a woman. It normally occurs in a woman approaching menopause. This condition results in inflammation or a possible blockage of the ducts underneath the breast. So when this occurs, there is a yellowish or greenish discharge from the breast. Fifth is an intraductal papilloma. This refers to a non-cancerous growth at the ducts of the breast. This is the most common cause of abnormal milk secretion from the nipple of a woman. When this intraductal papilloma is inflamed, it could cause a nipple discharge that contains blood. If you experience any of the above mentioned abnormalities, there are some certain tests that you should undergo, such as laboratory analysis of the discharge, blood tests, mammogram or ultrasound of one or both of your breasts, brain scan, surgical excision, and analysis of one or more of the ducts in the breast. If you found this video interesting, please do well to subscribe to our YouTube channel, like, comment, and share to your loved ones so that they can as well benefit from it.